hopefully that should be on now. We've got a yes, we've got back now, we've got done it. Wow, yeah, there's some tests for me today, isn't there? So great. Okay. Unfortunately, when I go on to the actual presentation, I'm not going to be able to see these comments. So I'm going to leave my phone just in front of me, and I will rely on some trusted colleagues to text me whether or not the sound has gone off. But I'm relying, yeah, everybody's saying you can hear me now. Good. I'm not going to touch anything else apart from my mouse. Okay, fantastic. So I'm not sure how much you guys heard me. I'm going to go through the introduction really quickly because we've already wasted or I've wasted 4 minutes from not getting any sound on there. Okay, so just some quick. So CPD points, we've got one for today. We're going to do some questions. I will be stopping myself during the presentation and saying, right, here's some questions. I can see 33 already, but I think that might be you guys just telling me to sort the sound out. So we'll address that when we come to it. And also, as I said, in terms of IT, we can expect that. I can't hear you or see you, obviously, as you all know now. But yes, if you don't have any problems, put some questions up there or some comments up there, and hopefully I'll better see them. Okay, so firstly today, this is something that we've put together pretty quickly for you. I think it was sort of last Wednesday or Thursday, we realised, look, we need to get some more information out there to our members and hopefully give you some clarity and advice on some really important questions. So, we put this really together really quickly for you. The BPCA team, I mean, have just been amazing. Our Marcoms and our CEO and all of our management teams, getting all of this information together and keeping an eye on it and keeping us all up to date on what's going on. It's just been amazing. And this webinar will hopefully condense some of that for you. As I said, we've only got an hour, so I don't expect to answer all your questions or prayers or anything like that, but I will do my best. As I said, a lot of questions coming through already. I probably won't be able to get to all of them, but I promise I will try to address the most important ones. And anything after that, you can get in touch through email or telephone and speak to the technical team. Okay, so I am going to share my screen. So everybody keep our fingers crossed that this is going to work. So, okay, we're going to go from the beginning. Just give it a few little minutes to respond. There we go. Okay, so I'm solely going to be relying on my phone now to flash up any messages with regards to technology and whether it's working or not. But hopefully you can all see the first page coming up here with regards to what the topic is. So yes, we will address everything as efficiently as possible. Okay, so we're going to have a few disclaimers through this webinar, as you can imagine, because, we are not COVID-19 experts or advisors on the disease itself. We don't have that information. You really need to go to, for all proper medical information, you need to go to NHS or government bodies and all of these links that you can go to get that information that's proper, up to date. And as we know, things are changing a lot. Yes, but we're not COVID-19 experts, but we can hopefully help you make some decisions while you're out and about in the field. Okay, so lots of useful links as well coming up that hopefully we can use. As I said, lots of disclaimers. So another one, this webinar is not a replacement for the guidance given by medical professionals nor official advice provided by the UK government on COVID-19. So really important we keep up to date with that. All the factual stuff, that's what you want to know about in relation to your business, because that's why you're here, isn't it? You want to know what you can do and what you can't do. I said another disclaimer there. So the rules are changing, as we saw from last night. The new restrictions and new information given out by Boris Johnson, and that could keep changing every day, especially with regards to businesses and what can run and what can't run. So this webinar today, we've made it. Even this morning we put some changes into it and added a few slides just to make sure it was the most up to date it could be. But just keep be aware that things are changing regularly. The bits we're going to cover today, so can we even go to work? That will obviously, it's one of the main questions that we've had in these last few days and weeks, and especially since last night as well. That's an important question we're going to cover. Is pest management a critical service? And then should I keep trading or go out on some jobs? So we will certainly be addressing those. We'll do some questions just after that, because I think those three areas are certainly going to be where you're going to want to ask some questions with regards to what I say. And again, we will try and answer it. I know the BPCA, not the BPCA team, are watching as well. So if there's any questions you have that, maybe kind of struggling to answer, they might better chip in and help also. So a real interaction there. I'll read out the questions and then we'll see, as I said, if it's something I can answer, great. If it's not, then maybe there's going to be some feedback from other people watching. As I said, there's over 500 of you now. So yeah, quite a few people to be able to hopefully input. Okay, so after that, we'll obviously go into how you keep yourself as well as your clients safe, and what is BPCA doing to I'll try and help you and influence in these hard times. Okay, so let's get going. So first question then, can you go to work? And from what we saw last night, the simple answer is yes, you can go to work. The guidance is very clear that you can continue to go to work if you cannot do your work from home. Most professional pest management cannot be done from home. So it is something that we feel, from the guidance last night, it's not a case of you must stay at home, you cannot do any of your pest control work. The guidance does not state that only key workers can travel to work. Boris Johnson did not say those words. So to be clear, at present, pest management professionals can go to work during the government's partial lockdown. But really, you want to ask, should you go to work? And this really is a business decision that only you and your client can make on a case-by-case basis. BPCA, we cannot make this decision for you. We really can't. We can talk through it with you. We can give some, as much guidance as possible, or advice. We've got a flow chart coming up, which we published a few days ago. So many of you may have seen it. We'll go through it and have a chat about it. But, we can help you try and make those decisions. But at the end of the day, it really is down to you to make those decisions, with using your client as information, and also your own processes, and being able to get to that decision point. So we've got lots of guidance there. If you're still not sure whether you should go to work, like I said, you can contact us, have a chat to us about it, give it a case-by-case scenario with us, and we can talk it through. Some of it is going to be common sense. So, okay. So yeah, that's how we see with the pest control services. Pest management is an essential service. BPCA has told the government. We have written to Boris Johnson. I think a lot of you might have seen that letter on there. We've written them to remind them why pest management is so important. We offer support and disinfection and hygiene services, some of our members, and also to be considered as key workers. But the things that we do have a critical role to play in many sectors. Just thinking about food and farm to fork, we still need this food to be reduced. We still need it to be farmed. Also protecting other essential workers like hospitals and supermarkets. If these hospitals and supermarkets, they could still get pest infestations, and we can't necessarily just say, okay, well, that's all right, we'll leave it till this is all over and then deal with the massive infestation as and when we can. It's just the public health risk is immense. And, in terms of, pathogens and diseases, we can't allow them to, or people to be exposed to them. And also protecting the vulnerable and the sick from exposure to diseases that, whether it's rodents or insects may cause, and also protecting distressed and mental health anguish, because we all know that, we've all had those phone calls, those face-to-face meetings with customers that, are particularly distressed with what's going on. Just having a little look, make sure my technology is still working. I believe it is. I would say to my colleagues watching BPCA, if you can call me on my mobile if there's an issue, because I should be able to see that flash up quite easily. Unfortunately, I haven't got a dual screen here, so I believe it's all still okay. So I will continue. But yes, so as I was saying, when this pandemic is over, we don't want an overrun nation with pests. We can't. So that's how we see things. However, obviously, we've got to remember that the risk of spreading COVID-19 needs to be balanced against the risk of inadequate control and the management of pest species. So you really, I mentioned it in the slide before, you've got to make the decision. You've got to balance up. Okay, I've had this phone call. It's a certain pest problem at a certain site. What risk is greater here? That pest or the risk of spreading COVID-19, be it yourself contracting it or a technician or you passing it to someone on that site where the pest problem is. You've really got to weigh that up. And, every case is going to be different. Every case can be different. We will go into that a bit more. So got to weigh that up. Okay, so only essential contacts. This is the general guidance that the government is giving, and is common sense really. Only essential contact should be permitted. So if there is some work and you're not sure whether or not it's important enough, or in the back of mind you think, well, this site isn't high risk, it hasn't had a problem for a very long time. Is it something really we need to be doing? Then maybe the answer would be no, because that only really essential contact. But we will talk about that a bit more as we go on. But as I said, by nature, pest management is an essential service. We cannot do without it. So yeah, we developed, I think a few of you hopefully saw late last week that we developed a flow chart, an article, but we had a flow chart in there in terms of, just something to try and help you make these decisions. We don't expect it to, as I said, answer all of your questions and all of your prayers, but again, it might just give you that little bit of guidance and information on how to make your own decisions on what you're going to do. So this is what it looks like. We'll go through it just step by step, and hopefully then we can get some questions afterwards. But the most important bit is that each step encourages you to assess and mitigate the risks yourself and with your client as best as you can. That is going to be your communication, yourself and your client. You're going to have to communicate well, decide with each other in mind what's safe to do and what's not, and also balancing the risk. So what pest problem have they got? How big a problem? How it's going to affect public health, and whether or not it's something you need to go and deal with. So yeah, this process should, we recommend it's followed before every job and dealt with case by case. So the first bit's here. The first question you need to ask yourself is that, does the job need to be done during this pandemic? And, you've normally got two categories of pest control, obviously being very generic, and that would be your routine contracts and then your proactive or reactive jobs where there are current infestations. So, you maybe will want to split the two up and say, well, in terms of your routine contracts, is there a high risk on that site? Have you had historic problems? Things like that. If you haven't had a pest issue for some years, or if it has always been on a particularly low level, then maybe those sites can be just communicated via telephone, or and just keep in touch with them that way, and just get them to let you know whether or not they've got a problem. But generally, the routine stuff might need to be considered as slowing down just for the time being. But yes, you need to ask yourself that: is there a critical and imminent threat to public health if you weren't to attend that site? Obviously risks of food contamination and therefore disease, really important. We all still need to eat during this pandemic. We're all still going to the supermarkets where, those farmers are still creating the vegetables, the corns or the for us to be able to consume. So we need to make sure that food is safe for us to consume. And maybe is the client distressed to the point that their mental health is affected? Again, you can normally tell these things. It's generally going to be the domestic end of the market that you come across this certain distress, and it's for you to weigh up whether or not that's something that needs to be prioritised. But if the answer is no to any of these questions, then don't visit. I guess is the advice, but maybe consider, advising on hygiene and proofing until it's safer to do a visit. You can do pest awareness training over the phone maybe, or a video conference. We're pretty, as you know, we do a lot of video conferencing and webinars. So if you wanted some advice on how to do that, I'm sure, the BPCA team, myself a little bit maybe, but I'm not as technical with these things as say our Marcoms manager Scott. He's great with all of this. So I'm sure we'd be happy to give you some guidance on how to do video conferencing and to make it a really good benefit for you and your customer to keep that good relationship going. And also routine visits might be missed on a site. But maybe do some sort of basic training with them online about how to just notice things around a site. And if they do notice an infestation, they can give you a call and you can get there. And again, maybe weigh up that it's important. Okay, so that'd be the first step. So if the answer to that question was actually yes, there is a massive public health risk, or I do consider this problem needs to be dealt with, you've got to ask yourself, do you need to be on site? We've got a separate section for yes there, but if no, can part of the work be done remotely by video call? It's not going to be able on a lot of issues, obviously, because you've got to be there and actually do things. But again, it might just be some advice. Can the survey be done remotely? If you want to do surveys, maybe a trusted employee on the site, they take their phones are great these days. You can carry them around and show certain things, or send photographs of whatever pest they feel they might have, and you can do some identification as well. So consider all these things. As I said, we get photos of all sorts of insects coming through to do identification, and it's something that can be very useful, and your customer can appreciate it. Gives them that confidence that there's somebody there to talk to. I believe everything's still fine in terms of sound again. So the part to that. So if you feel like you do need to be on site, then you've got to ask yourself, are your staff protected? Making sure that, no one is currently self-isolating in the premises. There's going to be more, obviously, domestic work, isn't it, where that's going to be happening. So you need to be asking these questions. Have you asked your client if their staff on the commercial site are well? Are there any concerns there? And do you have the correct PPE and hand washing facilities? Hand washing is a very important part of this. We'll touch on that later, but probably one of the most proactive things that you can do to prevent or help prevent the spread of this horrible disease. Are your staff health records up to date? Are you sitting down with them? Are you asking them questions? You're speaking to them on the phone. You may be getting on video calls with them. Making sure that their records are up to date and you're aware of any underlying health issues that any of your staff might have. So the government websites have got the list of those at high risk underlying health conditions. And do you know for certain that the technician isn't in a high risk group? You can obviously only ask the questions and ask them again. But yeah, you've got to make sure that you have asked those. Are you and your staff up to date with current government guidance? You need to be looking at that guidance and making sure that you can demonstrate this as well. And also, speaking to your insurers and your suppliers, your insurance will cover certain things. So keeping a good eye on what your policies are and what you're covered for. And also speaking to your suppliers in terms of the products that you need, the personal protective equipment you need, and making sure that's in good supply. So then the question, so if you've got to be on the site, you've answered all them questions, you've got to always say, well, are there vulnerable people on the site that you're going to? If you've got answer no there, we'll go on to the separate section. But if yes, you've got to really ask yourself, does the pest infestation risk outweigh the spreading of COVID-19? As I said, we can't answer that as a yes or no specifically, and even case by case it can be a discussion, but ultimately you've got to make that decision yourself. If there is an active pest infestation, you may decide that it's important to carry out a treatment, but you've got to be the one that makes that decision with your customer. So speaking to them, finding out what the problems are, weighing up what the risks are. And as I keep saying, and I will keep saying, we are more than happy to discuss case by case these items. There's three of us technical at BPCA, as you know, so I'm sure you'll be able to get through to us and have that conversation if you need to. So yeah, if no, then do not visit. But you've got some things that you can consider. If you decide not to arrange a visit, you've got to make sure that glue boards and things like live capture traps are deactivated. Really important, obviously, legislatively. We can't be catching any animals and not be there to remove them or dispatch them. It's really important that you do that. Also, rodenticides that might be on site, certainly, if they're external, if you've got long-term or permanent baiting strategies in place, you've got to consider those label restrictions. We absolutely, cannot say and will not say that the current situation will allow you to go against label conditions. You've got to keep that in mind. So if you've got sites that have got this long-term baiting strategy in place, it might be something you need to consider in removing if you can't still service that site safely in relation to weighing up the risks. But you certainly need to address that. As always, we're not talking about treatments as much today, but always, use pesticides in accordance with the label requirements. It's really, really important that you still do that. It's still relevant. We can't be giving pesticides to customers and directing them in how to use them just so that we don't have to go on a site. That's not something that BPCA could support or advise, because it would be against label conditions and not particularly safe or effective. There's those few bits there, but just to remember, it's important that you need to act as you're a key worker, because you are. We might not be definitively listed as a key worker, but you are. There are things that we do, the pest management industry, that cannot be done by anybody else. And if there was a pest infestation to appear in the wrong place, then we need to deal with it. How is that not a key worker? But yes, follow all the government guidelines on social distancing, of course, and hygiene. Talk a bit about that in a moment, and make sure you're properly assessing all risks to yourself, teams and clients. Write these things down. If you're doing them, write them down. Always my recognition. If you're in doubt, don't go to the job. Maybe give someone a call, be it us, and we can have a talk through and hopefully come to a decision for yourself by talking it out with somebody. That can always be helpful. Okay, so we've done nearly half an hour. That's good. So we've got some questions. I'm going to stop. Oh no, I've got my question box here. So I've got 65 questions that have come through since we've begun. I certainly will not be able to get to all of them, but I will certainly try my best. So we did have one on early doors, and I know this was something that come through earlier. And the question is, will the pest control industry be classified as key workers from the government? Clarification needed. So I did mention that earlier. We have written to Boris Johnson, as I mentioned, to remind them of that. And at the moment, key workers are allowed to continue to send their children to school and in the future, etc. So we want to be on the list for reasons like that, but to also recognise that the work that we do is important. As I said, it hasn't been officially classified as such, but we're still taking that assumption that yes, we are. I think I would say, well, explain to me how we are not key workers. That's possibly the question. So, yeah, not classified officially in terms from the government, but we are still continuing as we are key workers. Okay, so I've got lots of sound gone bits here, so I'm just going to have to go through, delete sound on. There we go. Got a question here. So, will pest control companies / technicians be needed to start sanitising and disinfecting affected and unaffected areas, i.e. schools, colleges, NHS buildings? I mean, I don't know. Really, it's going to be, you've got to have the proper knowledge and experience with regards to sanitising and disinfecting. And, it's fine when we are addressing, say, for example, rat infestations, when there's been, urine or drop-ins that we've cleaned up, we will disinfect those areas. We're familiar with those. The products that are available to us for that, we're well versed in and trained in, and we understand them. Whereas, disinfecting or sanitizing an area, like a school, for example, for COVID-19, I mean, is that really something that we feel we are qualified to do, or we have enough knowledge, or that we kind of have that professional element to be able to offer that service? That's a question you've got to ask yourself, really, and also the products that are out there. So I can't, it really is down to you to make the decision. But whether or not, governments will be needing pest control companies to take up this or fill this potential gap in offering this service, then possibly, but I'm not sure with that. There was two parts to that. So will this be something we should be getting involved with independently? Again, absolutely up to you. And is specified training required to deal with the virus for deep cleaning perspective? I kind of answered that, I think, a bit before there. It really is up to you to decide whether or not you have that experience or skill. If you've got a manufacturer or distributor that you use, you can talk it out with them. They're the ones that produce these products. They might be able to give you some training on it, possibly. But it really is something that you would need to have a look at yourself. Okay, and we go. My audio's gone now. I think my audio is back now. This was from earlier. Okay, so we didn't have 64 questions. Sound's come back now. Okay, here we go. Oh, don't worry. Someone says, "Poor Natalie." We can hear you again, but don't worry. I'm fine. I don't mind having these technical problems. It's one of those things. I know that is what it is. So what are the qualifying criteria for longing employees, and do you know how we can access the portal to this? What are the qualifying criteria? Sorry, Mike Osborne. Sorry, I can't read. Can you put that question on again, Mike? I can't read that question properly. Apologies, but I'm not sure what we're getting out there. Okay, another question. I would like to know what happens if you have enough work for the next 2 weeks with companies that are still open, then not have any work for the following 4 weeks, then able to service again after that. How do we do intermittent layoffs? As staff can't work, then they can, then they can't. I get what you mean. That kind of, as you said, intermittent. Again, I can't answer all of your questions, all of your prayers with that. It's business related. You've got to make sure that you're prepared for it. And as you said, if you've got 2 weeks of work and then you feel you've got 4 weeks where there's nothing, in terms of staff, you need to be consulting a human resources professional. If you don't have them, we do have a member benefit, business shield. There is some HR support and advice you can get from them. It's worth giving them a call or an email. Hopefully they won't be too inundated with queries, but even if they are, I'm sure they would be able to get back to you if you don't already have your own HR advisors. We're public health, pest control experts, and in terms of human resources, it's certainly not my area of expertise or many of the BPCA staff team. However, there is that service of Business Shield that can offer you HR support, and you may have your own professionals that can offer that to you as well. Okay, so can we carry on routine work or only cover call-outs / emergencies? Covered that a little bit, I think, sort of before this question came in. And that, again, it really is for you to weigh it up depending on the risk to public health, the location of where this work might be. And then again, going through that flow chart and just really trying to make those decisions case by case rather than just a blanket, we're not doing any routines or we're not doing any, fly jobs, or, it really is going to be case by case. So can I receive a copy of the presentation? Absolutely. If at the end of the presentation you still think that I've talked some sense or we've made some sense, then yeah, absolutely. Within a day or two, our Marcoms team will have it on the website under old webinars. So yeah, and it'll be on YouTube, I think, as well. So absolutely, it is available afterwards. Can you let us know the government's reply to your communications? We will, as soon as we have any communication from any government department, we will get it up. For example, last night, obviously, Boris Johnson's new announcement. It was probably earlier than 7 a.m., but 7 a.m. was when I saw the first communication from our Marcoms regarding us putting some information on our website about it. So, as soon as we possibly can, we will be putting out bulletins, updating our news feeds on the website with regards to any replies. But, if we get any replies from governments for any of the questions we've asked, you will be the first ones to know. Obviously, we'll be the first ones to know, but we will communicate with you as quickly as possible. And keep in touch, email or give us a call just to check up on us, but you haven't missed anything. But you can go on our website and click on the news section, of our website, just to keep up to date. Like I said, the Business Shield, not all of you on here might not be BPCA members, because it is only available to BPCA members, as is technical support. But yeah, if you haven't got access to that, then hopefully you've got your own HR regarding staffing before. But yes, communications will always get them out. So another question, are field biologist inspections deemed essential? Again, it will be something for you to weigh up and discuss with your customer. We have had communication, or say had communications. We have asked for information from some of the auditing companies. So, for example, BRC, we've asked them, is this something you still going to be auditing? Are you still going to be expecting these sites to be keeping in line with the standard and having regular inspections, for example? So we still haven't got communication back from that, I don't believe. Again, everything's changing all the time. But yeah, certainly in terms of field biologist inspections, it'll be site by site. Speak to all your customers. Got to ask that question to all of them. Someone said 1:45 that there was no sound, but I'm assuming it came back again. Hopefully it did. I'm going to do just another couple of minutes, just another sort of 4 minutes or so on questions. There's still 60 open questions, and I think most of them are as such. What is the BRC saying regarding audit? Okay, I just answered that one about BRC. We have asked them what it is that they will be recommending or what they need regarding their audit compliance. So again, we will let you know as soon as we know the answer to that, Paul. So someone here knows, I work for a local authority. We offer an advisory service involving surveys at members of the public's homes as a temporary bridge, as our service can't be provided to its full ability. We were considering advising people with ongoing rat infestations to fit non-return valves where suitable/appropriate. Can the public do this themselves? Is specialist training required? Our goal is the protection of public health. We do not charge for our service. So I think with regards to, the valves that you can put in, it's not a pesticide. Specific training isn't necessarily needed. However, you've got to fit these things properly. Otherwise, you can damage the drains or the sewers. And I know certainly with some, water boards, they don't overly like the fitting of these non-return valves, because if they're not done properly, like I said, they can cause damage. So yeah, it's one of those to really, it's up to the customer. If it's their drain that they're fitting it within and it's their responsibility, then they're going to want to fit it properly, aren't they, and do a bit of research on it. And maybe this is the sort of training that you could do on video, online. You can do a similar thing like we're doing now, a webinar, and speak to your customer and show them how to fit them. Again, all part of the service to try and keep it all going, keep yourself in touch with them. So can you confirm what you are doing to ascertain if, as pest controllers, we will be classified as essential workers by the government? As I said, mentioned it earlier, we consider we are essential workers, we are key workers, we are needed to protect this company from pathogens and diseases that pests can spread around. And as I said, it was last week that our CEO wrote to Boris Johnson to ask and to, for them to ask him to include us on that list. And any communication we have back, we will certainly be getting that out to you. Just keep an eye on it. Can you clarify what a vulnerable person is? Baby, infant, elderly, and underlying health issues. Again, we're not, you need to check the official government guidance, and they have a list of people that are vulnerable. But yeah, certainly, as you say, the elderly and underlying health issues, there is a list of health issues that are of most concern. I know things like severe asthma is one of them. Certainly someone who's taking regular medication for it and be a vulnerable person. But as I said, we're not really here to advise too much on the official government guidance and guidelines. It's all there for you to have a look at. It is a matter of finding it, and I know there's a lot there, but you can get these alerts from the .gov.uk website, which are going to be the most reliable for you. Okay, so I'm going to just, we have still got questions coming through. I did have 60 earlier and I've got 61 and I've already answered a fair few. So I'm going to carry on with the presentation. Again, hopefully I keep clapping my hands, so I shouldn't do that with the sound. I will try and get to all the questions, but as I said at the beginning, it's likely I'm not going to, because there's a lot on there, and I need to limit this to an hour for you guys, because I'm sure you want to get back out there and get sorting your business out and your work and deciding what you can and can't do. So I don't want to keep you too long, but remember, we're still here. But we'll do some more questions at the end. Hopefully we will have some time. Okay, so let me close that window. Again, I will rely on a phone call from my team. It needs to be a phone call, because I'll notice that's different, because I've got 100 text messages on my phone at the moment. So any sound or visual problems, just ring me, somebody, and I'll take that as something's wrong. Okay, all good apparently. So moving on to some other bits, just a bit of just to get involved a little bit, just for those who haven't asked questions yet, just a bit of typing on your keyboard. We'd like to ask you, in your opinion, what is the single best way to protect yourself and your clients? We're saying that you can still go out there, you can still do this work. In your opinion, what is the single best way you can protect yourself and your clients? There's a chat ability to chat. I'm just going to have a look now, see if anybody's okay. So we've got PPE, wash your hands, stay at home, communication, use some common sense. Common sense is, absolutely part of it. Stay home, PPE, there's keep your distance, social distancing, absolutely. So quite a few come in there. What we say, really, a few of you did, sorry, it's not working there, did mention it, is, wash your hands. Certainly, you do that when you get home from work, when you leave for work in the morning. You wash your hands before and after visiting a client site every time. Use a hand sanitizer or gel if soap and water are not available. Obviously, we're very mobile, aren't we? And we're out there in vans and vehicles, so we're not always necessarily going to have that hot water and soap. So, get the best available alternative, and at any opportunity that you have, make sure, you do get that hot water and soap and wash your hands. Really important. So, and do it for at least 20 seconds. There is some guidance, like I said, from the government in terms of, there's quite a few things out there and people saying, I don't need to be told how to wash my hands. But, it's surprising how, how little some people, do wash their hands, or for how quickly. That's the main thing, is that, if it's just a very quick, splash of water and splash of soap, it's not going to have the desired effect. So we do, that is, in the opinion of the government and also ourselves, is that is the best way you can protect yourself, because these are dirty things. Our hands, we touch everything, we do everything with them, really, don't we? So we need to make sure they're clean, and we're doing that regularly. Okay, so protecting yourself and your client. Again, this is all guidance that you can find on the government websites. Like that was saying, coughs and sneezes spread diseases, as we know. So make sure you've got tissues with you all the time, because it's great saying, "Oh, if you sneeze, catch it and bin it." But if you don't have anything to catch it in, it's just going to be going in your hands or your clothes. So make sure give your technicians a packet of tissues to carry around. It might be a good thing to do. Obviously, you can, you've got to cover your mouth and your nose with that tissue, or your sleeve, of course. But tissue is preferable, of course. Put them bin straight away. Try to avoid that close contact with people who are unwell. I mean, I try to do that generally anyway. But yeah, certainly now, really, really important. And don't just try and not touch your face too much. We do it sometimes. I've probably been doing it and not noticed it today. I've kind of been sitting here like this or this and touching. So try to avoid that as much as possible. And pay particular attention to situations where you are, maybe undertaking actions that have been passed through cash, so things that are passed through hands. You just don't realise how much contact you do actually have with other people and possibly their germs and diseases. So consider these things. Like a lot of many supermarkets are saying they don't take cash anymore and they're just doing contactless. So really important we consider those things. Okay, so just a little bit about what we're doing, just to give you, we really are working very hard, and I know it's a 24 hours a day job for most of the BPCA team to keep up to date with what's happening. Any new guidance out there we think will help you, getting that to you. But we went through the flow chart and the initial article we put out last week that is there for you to have a look at, to go back to maybe download, look at it regularly and just remind yourself and help you make those decisions. Again, like I said, we've written to the UK Prime Minister and different government departments and the business and ministers to ask them to be designated key workers and speed up this relief. So, we have asked those, and as soon as we get any information or feedback on that, we will, obviously, you'll be the first ones to know. Also wrote some letters. So we've created a template for members who want to keep their children in school, because obviously this key worker is related to the ability to mostly to be able to keep your children in school and assist with you still being able to go to work. The letter is addressed to headmasters and local authorities that have to interpret the government's guidance on what a key worker is. These are the people that interpret it. And the letter explains why pest management professionals are included as key workers. It's signed by Ian and the pest management professionals, Ian, our CEO. And we know the letter has been successful in some situations. However, from the media, we know schools are filling up very quickly as well as their allocation. But that letter's there for you to download and use if it's something you feel would help. And of course CPD activities, today we've got some of that, and we're still hoping that it's something we want to do, trying to get those CPD points, some more training. Maybe there's some training that you thought, I've actually maybe a silver lining, a very small silver lining to a horrible cloud. Maybe you're just better squeezing that training you've been meaning to do, or that extra webinar. And these things I know they're being looked at by those that deliver training to be able to do it online for you, because obviously classroom based and that social distancing can't go ahead, but certainly trying to deliver things online is going to be looked at by us, as well as some other manufacturers, distributors and training organisations. So keep an eye out for those. So yeah, if you, as it says down the bottom, you need to tell us what you want us to do, what questions you want us to ask, how else can we help you during this pandemic. Everybody is in the same position. Whether you're a plumber, electrician, or pest control, the services we provide are really important, and we know that, and you know that, and we'll keep going until we're told otherwise, because it's a really important service. Okay, questions again. So we've got 13 minutes. So I think I'll try and pick out some questions that I think are really relative to a wide group of you listening. I'll try my best with that. As I said, there are 68 questions on there now, and like I've said, I'm definitely not going to be able to get to all of them, but let's see how we go. John here says, I am avoiding going into people's homes as most of my customers are domestic. However, external work should be okay, but until we get something concrete from the government, shouldn't we all stay at home? After all, eventually we will be classed as an essential service. The staying at home, the advice the government gives, you said everybody will take the advice as they wish to themselves, but just as looking at the actual speech itself and the actual requirements, absolutely stay home if it's something you need to do, or if you have symptoms, or if the work that you do, you just really feel that it's not something that you can continue with, absolutely. But as it's mentioned, if you cannot work from home, then that is considered essential business travel. And if you have a pest problem that you feel needs to be dealt with because of public health risk, then maybe that would be the decision that's taken. But that is absolutely, John, that's your decision to make. Of course it is. Okay, Natalie, can you help define what BPCA would consider an emergency job, i.e. live rat in a dwelling or active wasp nest inside a dwelling? Your clients in the housing sector are looking for some guidance. So these conversations will be case by case. So live rat in a dwelling. So if we're considering you've got a live rat that's maybe come in once, you would communicate with your customer and discuss, how long the issue's been going on. Is it a one-off? And make that decision between you and your customer. I mean, at the moment, it's just between myself and you. And we can talk about it till the cows come home, but really it's important also what your customer feels, or whether your customer or that person who's got a rat in their dwelling, whether they're self-isolating, whether they have symptoms, whether they are concerned about you bringing in COVID-19, and they might say, well, I don't really want you here. So it really is a conversation to have. And I think the time maybe to ring, to give us a call is to say, right now, every time you get a pest request, speak to your customer, get as much information as you can about their situation. And if you're still not sure what to do, you can give us a ring then, and we can really go through the detail and try and help you come up with something. But if there is risk to life, for example, a wasp nest that's active in an area that could have catastrophic consequences. People can die from wasp stings, as we know. And as time goes on, when these nests get bigger, obviously at the minute, I don't think it'll be too much of a problem. But if there is that risk, and you think actually that outweighs the risk of the COVID-19, you would put in measures to make sure you're still not spreading any risk of spreading COVID-19 or contracting it yourself. But you would maybe then decide to still go to that and treat that wasp nest that was causing a potential, injury, or potential, high risk of severe injury. So you've got to make that decision case by case. So if we go to a job and put down rodenticide and then go into lockdown, are we liable as we do not follow the follow-up visit as on the product label? I think that there's sorts of things that we can maybe ask crew for some feedback on and what they think, or maybe even HSE, because they're the ones that obviously are responsible for these labels and authorising them, and therefore, that's what the legal side of what we need to adhere to. So My common sense would tell me if you put rodenticide down and then we go into lockdown and the authorities say you are not allowed to leave your house regardless, then there's not much we can do, really, is there? The liability for that would not necessarily exist because there'd be nobody to enforce it. And if they did, they would see that you couldn't get to that site. And also the label conditions does say that you need to remove all rodenticide so far as is reasonably practicable. It's wordings like that. I paraphrase a bit. But yeah, you've got to try your best. Some sites you put rodenticide down and then the customer won't let you in again. You can try your best, but you can't go smashing the door down. So, you can mitigate your risk by, sending letters to that customer and say, look, you're not allowing me to take your bait. So, it's down to you now. So just with that in mind, if you were to put rodenticide down and you were not allowed to go back in to retrieve it, then you would be fine. That is absolutely my common sense opinion on it. So do you think that membership to a trade organisation, i.e. BPCA or MPTA, will help government recognition of professional pest control technicians? Of course, absolutely, Peter. I think any trade or trade industry that has a trade association and they're members of that trade association, it works towards lobbying government or recognition of the professionalism of that sector, and obviously in our case professional pest management. Absolutely, being a member of a trade association certainly works towards that recognition of us being professional. Key workers, essential workers. What is the BPCA view on companies offering disinfectant services, particularly those who have not previously done it? I think I did mention that earlier. I think I possibly and hopefully addressed it already. But yes, it's if you feel you've got the proper experience and training, then obviously, okay, it's more the products as well, and whether or not what you're offering you can actually give your customers the confidence that what you're doing is going to work. Considering what we have here, COVID-19. We are not COVID-19 experts, in terms of what kills it, controls it, and gets rid of it, apart from what the government advice tells us in terms of cleaning. So certainly not a question I'm too good with. Okay, so are you working with the MPTA on lobbying the government, as the two main trade bodies working together is surely better than one? Yeah, I'm sure we all agree with that. Absolutely, that is a question for our CEO, Ian Andrews. I'm sure we've had some communication with them. Absolutely, good point, Martin. Thank you for raising that. Another question there. So because we work for public health, why are we not instant key workers? And these are the questions we've asked, Lance. Exactly that in the letter. We've got that, and as soon as we see anything on it, we will get it out there on communications with you. Okay, so how long have I got left now? Got 4 minutes. It's good. Getting through a few here. So if we have baits down externally due to rat activity and we can't service them, burrow baiting monitors, etc., will we be hauled over the coals if a non-target dies, or will common sense prevail? Again, I think I might have mentioned that a moment ago, Kevin. Where if you've got external baits down and you can visit them safely now, or over the time to come, for as long as the status remains as it is, that we can travel to work and carry on with our pest control. Consider, do you need them down? If you do, if there is a current activity and you consider it to be of public health concern and you need to carry on with that work, then at the moment, as I said, the stance is that you will carry on with that work. But certainly start addressing that now, and whether or not you need those external baits down. And I think if you were to have baits down and you were told you cannot leave your property and go and service those baits, and as you say, common sense should prevail, and but I can't answer. I don't know. We're not there. Hopefully, we won't be there. But I'm not the authority that deals with that. But as you said, common sense should prevail that you wouldn't be hauled over the coals, as you say. Another question. So, is it acceptable to carry out bird control on farms as many have started drilling seed? Yes, I've seen that today. Again, it's that weigh up with risk. You've got to weigh it up. Again, using some common sense, in the more rural areas, obviously social distancing probably isn't too much of a concern. You can probably do that quite easily. You can have the hygiene measures that we've mentioned with washing your hands and ensuring that as far as you can, that you're not bringing anything to your customer, i.e. COVID-19, that you don't want to, and also that they don't have any issues or concerns with regard to their health. And if they do, you talk to them and keep that distancing. But, as I said, we've got to keep our seed safe. We've got to keep our arable farming going to be able to, still eat. I absolutely. I would say it's acceptable to still carry out bird control as long as you follow the steps that we've recommended and the government advice. Absolutely. So, okay. Are there any label requirements of checking baits? I think we spoke about that earlier. So that's another one. So another question from James. I suspect that very shortly we will require certification of some sort to drive to specific jobs. Pest management remains critical to the UK infrastructure. Is this being actively discussed as a strategic level? And in addition, are there any government differences across the UK regarding pest management response? So Scotland, England, Northern Ireland, etc. Like you said, what is going to happen over the hours, the days, the weeks, the months, in terms of decisions, we don't know. And, we may need certification to be able to drive to some specific jobs. And again, we consider it to be a critical service, and that will be the case. It's actively being discussed, I'm sure, across the board. I'm going to have to leave it there now. We are exactly at 1:30. I've got 81 questions that are still to go, and unfortunately not going to be able to answer all of them. So anybody here that wishes to reiterate their questions and send them in on email to the technical team, you can go on our website, you've got all of our emails and contact details there, or give us a call. Obviously bear with us, we will have a lot of communication coming in. If we don't answer, leave us a voicemail, who you are, and we'll give you a call back or an email, and just sort of give us a bit of time to reply to you. But I promise we will do as much as we can, as quickly as we can, as efficiently as we can. And I'm sure you'll probably see me or one of the other BPCA team again on here at some point, maybe doing some more updates and hopefully trying to give you some good guidance. I'm 1 minute over, so before I get told off, I will say thank you everybody for attending, and I hope you all stay safe, and we will speak very soon. Thank you.